Thanks for tuning in to this special edition of the Best Practices Show podcast. This year we were presented with something we didn't expect, which was a pandemic, and a lot of us were shut down. During that time, we put together a COVID-19 dental relief conference, and we had some of the greatest teachers in all of dentistry come forward to inspire this incredible industry. In this series, we're going to go back and take a look at the best of the best from that COVID-19 dental relief conference. We hope you enjoy it.
Hi, good evening, ACT. I guess I want to say ACT family, ACT friends, ACT colleagues, team members, taking a moment here tonight in between board meetings to send you off a message. I spoke with Ashton and I thought I'd do a recording. I wish I could be with you all today live to answer question and answers, and I'm hoping to be able to do that in the future. But let's go over a few issues today, a few pressing, I guess, topics that I think are pressing that are coming out of the American Dental Association. And then I'll keep speaking with Ashton. And if we have the availability, I will make every effort I can to be there on the next time you do this. So that way we can have a little bit more of an interactive scenario than me just making a recording. So the first thing I want to talk about, Gina, let's state the obvious. Numbers are going up. I think people are scared again. Some reports, depending on what you're looking at, are saying the numbers are higher than they were when we went through the initial pandemic. So what does that mean for dentistry? Well, one of the things that the American Dental Association board did was pass interim policy as a board, confirmed that policy at the House of Delegates a couple months ago, that dentistry is essential care. If there's anything we figured out during the first parts of the pandemic, was that oral care that goes untouched, undiagnosed, unviewed, unchecked, starts to become an oral health crisis. Through all of you and your state leaders, by direction of the ADA Board of Trustees and the leadership at the ADA with all of our team members there, we were able to get that message out to all Department of Healths of every state. And what you can see now is dentistry is being looked at as not even really being talked about. New Mexico, just starting Monday, did a mandatory shelter-in-place order, and dentistry was really not affected. I mean, it's urgent, emergent care, try to do your part, but no mandates by the governor or state government. I think we're going to continue to see these lockdowns across the country, different, levels of it, whether it become a state mask mandate or actual stay-at-home orders or closing of certain businesses. But we're going to continue to recommend that from a dental standpoint, you are essential care, just like your medical colleagues. You go to work every day, you practice the safest way you can. Hopefully you are following everything your department, and this is my admonition to you, follow everything your Department of Health is telling you to do. And hopefully when they made their rulings on the providing of oral health, they used the ADA Return to Work Toolkit. Continue to look at the ADA.org/virus website so that you can begin to add all of the things that the task force comes out with, whether it be, what do you do if a staff member becomes positive? What do you do if a patient calls you 3 days later and says they tested positive? What do you do right now if you want to provide vaccines? How do you get ready for that? How do you help your state if they're going through the deliberation of whether or not that's going to be allowed and possible in your particular state that you're licensed in practice? So it's inevitable that we'll have positive people, either as patients or as team members or ourselves during this pandemic. And please review what to do in those cases, following the CARES Act in terms of your employees, but also just following good Department of Health practices so that contact tracing will avoid what we're all fearful of it coming from the dental office. I hope you all had a chance to look at it. I think it was 2 weeks ago today, a study that came out. One of the things I was disappointed with back in 2003 when we began to go through this pandemic, and I shared this on when I was invited on the ACT webinars, was that there were really no studies done, medicine or dentistry, regarding aerosols, the whole aerosol issue, or even just any issue on how SARS-1 spread. And so here we are at SARS-2, and we didn't have those studies to fall back on. So you're beginning to see the ADA Science and Research Institute study this, and that's the first in a series of studies that will come out that you can use if you're in a leadership position, or where you could share that with your state leaders so that they have an understanding of the penetration of this virus in the dental setting. That study, look it up. Ashton, I can get you, and Kirk, I can get you a link to that study if you want one. Just shoot me an email. So that way it's easy to find. But it is still showing that less than 1% of COVID positive people in a dental setting, so well below the national average of folks testing positive. We are seeing that different Department of Health are doing different things when it comes to when somebody does test positive. An example, in my home state, I spent the better half of 1 to 2 hours with our state epidemiologist this past week, because we had some confusion in the state of New Hampshire. Some folks early on were being told, call patients from the last 2 days if you had a positive staff member and notify them, but tell them that the risk was very low if you're following, multiple layers of protection with N95s or surgical grade 3 masks with another mask over it and good eye protection, usually a face shield. So our state epidemiologist and his team was initially saying patients are really, really low risk. And then they changed course this week to say that they thought every patient in that situation should quarantine for 2 weeks. So we're going to see some of these things where dental leaders need to get involved. Dentists and their teams need to be well educated. So when these issues come up, you're able to speak to the Department of Health or other people who are the decision makers in your state to help them understand the safety within the dental practice and how we practice very, very close to the situation that you'd find in an operating room setting. So those are important things to have at the tip of your tongue, because you will receive calls if you have a positive team member or yourself from the Department of Health, and you will answer tough questions. One of the questions that I've been hearing is being asked is they want to know dimensions of your staff lunch area and meeting areas, and whether or not you have it labeled 6 feet apart, whether it's measured out, not just assumed. Because they're looking at that as an area where if you have a positive staff member, if everybody's in their PPE, right now at this time, they're treating dentistry like an emergency room or a hospital setting. If everyone's in their PPE and a team member tests positive, that team member goes home and goes through the quarantine process with symptom clearance at this time based on our ADA toolkit, not testing clearance because they have tested positive. And then the rest of the team continues to work, checking for symptoms just like you do every day. So they will call and they will review whether or not that in fact is true, or whether that team member who tested positive had periods of time with no mask on in a lunch type setting or a meeting type setting, or even just in a exhaustion type situation where if they're front desk personnel, they take their mask down when no patients are around. So be vigilant. Please do that, and you'll be able to continue to practice. The next issue I'll cover is the Health Policy Institute and some of the surveys that many of you have taken part. We are seeing a slow decrease in the normal volume of patients. It started off, if you remember, a few weeks ago at about 80% return to pre-COVID levels. It's down to about 76, 77% of normal volume. That's on a national average. There's some people who are way above what they had pre-COVID, and they continue to grow. But for the most part, people had about 3/4 of their normal volume. We don't see that changing. There is a population out there that will not go to the dentist, will not visit their medical doctor unless it's an emergency for routine care and preventative care until there is a vaccine. And we're hearing all the good news about the vaccine. We're all hopeful, both Moderna and Pfizer, stating really high success numbers. Let's hope that's true. Let's pray that's true. We are in phase 1 as a dental profession, so we will be some of the first to receive the virus. I guess what I would say here is take a moment and let's talk politics, but it may be in a different way. So the way I want you to think about politics, if I could, especially now that the election is over, is I see it even in my friends day to day. It's really hard, the way we're bombarded with 24/7 news, to separate our politics from being a person. And we've lost that, I feel, in our communities and in our nation. So for 1 minute, if I could implore you to be a dentist, to be a colleague, to be a friend, a boss, a compassionate person, and understand that there are no politics in a vaccine. If those folks in politics want to make it politics, as a dental profession, we're above that. Do your homework. Be part of the tooth party, not the Democratic Party or the Republican Party or any other party. Be part of the tooth party. Understand what it will take to be safe, to be in phase 1, to be vaccinated if the studies were done correctly. We've all had a science background. You should be able to look at what the FDA is doing. You should be able to read on your own and talk to colleagues about whether or not it was done like the development of all other vaccines in a much quicker fashion, and figure out for yourself if it's safe. You don't need a politician or a news reporter to tell you whether it's safe or not. And work with your Department of Health and decide whether or not you personally are going to receive that vaccine. You may find that it's mandated. If the Department of Health across this country feel that it is safe based on what the FDA has approved, I think will probably be mandated, both ourselves and our dental teams, much like the hepatitis B vaccine. So be prepared for that. An important part, a second part of that's the reception part of the vaccine. How about the administration of the vaccine? Let's chat about that. That's going to be state by state, dependent on the licensing board. Take the time to reach out to your licensing board. Ask them if they've had a chance to discuss this at one of their meetings and whether or not they have a position. You'll find, we're finding at the ADA, and you'll find that some states that you're in say absolutely not. We're not going to be administering vaccines. Other states, we had Resolution 20 at the ADA, which implored dentists and dental societies to be a part of the rolling out of the vaccine and the administration of it. Pharmacies cannot do this on their own. There are going to be too many people to vaccinate. Dentists can step up here and fill that gap. We passed a resolution at the ADA stating just that, our willingness to do so. Now it's going to be incumbent upon every dentist and every dental licensing board to take a look at this and see if it's right for their dental practice setting to do that. So please look into that. Another thing with regards to practice is testing. We're always being asked about testing. At this time, you've heard as far as antigen testing, not to test whether you had the disease, which would be antibody, but to test whether you currently have the disease and are able to transmit the disease. There's a rapid test and a PCR test. So 2 tests. Both of them are still emergency use authorization only by the FDA. just like you're probably hearing that the vaccine is most likely going to be administered or rolled out, and that's under that same category of EUA. So as far as testing goes, we're not at a point. I've told you before, be very careful. If someone reaches out to the office and says, we have testing, you'll be able to test your patients and your staff every morning in under 15 minutes. Those tests are not specific enough to trust. I have heard, and I'm sure all of you have heard, about people who have tested positive with no symptoms and a day later test negative, and it's called a false positive. And there's been anywhere from 5 to 30% of false negatives where someone has symptoms and on their third test and fourth test, they test positive. So please be careful with testing. We are hearing that there's a development of a saliva test, which is showing really good specificity, but nothing yet that we could administer in a setting of a private dental practice. Some of your colleagues may have accessed the testing, and they may be using it because they're a hospital-based dental practice or co-joined with a hospital, and they're able to use the policies of the hospital to get a test, a day before they provide dental treatment. Different situation. When it comes to private practice dentistry, we're not there yet. Another topic, let's talk Washington, D.C. and what's going on there. We're at that term of, I guess, gridlock or stuck in the mud. So there is a bill out there, and depending on what side you listen to, there's all positives for each side and negatives that each side will say about the other side. The facts are the facts. The bill is stalled. We're hoping in the transition to a new administration, the bill will begin to move forward. In that bill, there are provisions for round 2 of PPP funding, but the sides are not moving yet. So let's be hopeful. There also are provisions for a certain level where PPP is automatically forgiven. I don't want to mention what that number is initially because it will likely change. It'll be a point of negotiation. And, there might be other offerings in there that we'll just have to wait and see. So let's be hopeful that the sides begin to come together and work together for the betterment of the American citizen, an American person, working person, and all of our team members and ourselves can have some peace and feelings of relief. So I'll be hoping for that for you. And lastly, I just want to talk about membership. So ADA membership steadily since 2001, 2002 has been decreasing anywhere from 0.5% to 2% per year. So we're now in, the 60 percentile in that range, the mid to low 60s. So in terms of membership, one, we need members because I think we're doing a good job and we're providing value. We're not the quickest. I know all the arguments. I read the social media that, it takes us forever to react. There's a lot that goes into reacting. I felt one of our brightest moments as an ADA was handling of this pandemic and bringing people together early and being able to provide information. The ADA board was meeting. We normally meet 5 to 6 times a year, and I think in those couple of months we met 22 times was the number. For a period of time, it was every single day for a couple of hours while we were home. So I hope you take a look at that. To the members who are listening, thank you so much. We're going to continue to advocate for you in Washington, in every state, on a state level through your dental societies, with the Department of Health, and also with all of your legislatures as different dental bills roll forward, because we will get through this pandemic and move on to other things. So we will be there for you. And the last thing, and if you're not a member, please become a member. I hope you found value in what the ADA provided you. I'm excited about some of the things coming. ADA Business Enterprises is looking at new products, evaluating new products, which most states then co-endorse. We are constantly working in Washington, D.C. I'm excited about that. And we are rolling out a new website through our communications department, our digital transformation platform, which will be using AI. So being the youngest board member, I want you to sign on to the website when that's up and live, and see how quick it will be for you, and that it won't be a dinosaur anymore and tough to find, and it'll begin to learn you. So each time you sign on and you go on the ADA website, it'll become quicker and quicker for you to find the information you need. That's my hope, and I'm really excited that that will come to fruition. And then the last plug is for AdPAC. So it kind of goes back to what I was talking about with politics. I've had some tough conversations over the last month with folks from the New England district, of which I'm trustee, about, I won't support AdPAC because I don't support anything that party stands for. And I say to the person the same thing every time. What if the other side said the same thing? The only people that would suffer are our patients and all of us as dentists. So think about the tooth party. Think about giving to your AdPAC. AdPAC was instrumental in accomplishing everything with the PPP, everything with provisions of PPE early on, and fighting for us to become fourth on the list for PPE administration through FEMA. So those are my two plugs. Sorry to do that to you at the end. I feel like I'm selling my book I just wrote and published. So I hope all is well. I'm sorry I can't be with you today live, and I'm looking forward to the next time that we can be together, both live, where I can answer questions, but maybe even in person, coming soon. All right. Have a great day, everybody, and I look forward to you hearing all of your successes in our great profession. Bye now.
And this is why we love Rich.
Love him. Love the ADA and love what they're doing. So fabulous job, Rich. If you're listening, if you're on, awesome, just awesome. So
they did
cool.
Make mention of a couple of articles that were up that he said that we could reach out for. I have already gotten those. They will be up on the Facebook page, our Facebook group, our private Facebook group here as soon as this is over. I'll have those both uploaded. I've already read them. They're fantastic.
Awesome. Well, keep asking questions, and I don't claim to make sure, I don't want to give you the expectations we're going to be able to give you perfect answers, but we will be on the continual quest to get you those. And part of that is our good friend Robyn Reis, who is part of a fantastic company by the name of Bent Erickson. And Robyn, thanks for joining us today. Because the tough questions, I feel bad. We dish them right to you. These are tough, messy, unclear questions, and you have just been fabulous to add some clarity. So I would love it if you just kind of introduce yourself, tell us a little bit about you, the great company you work for, and then let's get right into the great questions everybody's got.
Beautiful.
You bet. Awesome. Thanks so much, Kirk, Ashton, everybody at ACT for inviting me back. Real quick about me, I'm a certified HR consultant. So disclaimer, I'm not a physician, I'm not a dentist, I'm not a lawyer, but I am going to try to answer your messy questions as best as I can and understand that there are some things that are considered medical that are outside the HR realm. So I would direct you back to your state health department. And that really leads me into some of the questions that I know were ahead of time asked on Facebook. So Ashton, thank you for tagging me on that, about some of the, what do I do if somebody tests positive? And Dr. Rosato, I don't know if everybody on here was able to see the whole video. He spoke a lot about some amazing resources that the ADA and the CDC, the toolkits, the flow charts. I would direct you to that as far as getting the medical advice as if a team member or a doctor tests positive. Same thing with a patient. So your state health department is going to be your guidance. And to jump into the HR considerations for when a team member tests positive or a doctor tests positive or a patient tests positive, I can tell you, if there is anything you can take from today, it's make sure you have a plan. I had 4 offices last week that I spoke to that found themselves about testing positive, and they were like, what do we do? So it's inevitable, like Dr. Rosato said, that you're going to.
I would have had her drive here first. But then, yeah.
So I would highly recommend that you come together as a team and make sure that you have this plan in place. So when you are notified, this is what happens. So of course, there's also the flu season and other just stomach bugs and sickness that goes around. And I think everybody's, heightened awareness is, immediately get tested for COVID. So I would, again, go back to what is in place for people who test positive when it comes to COVID, and that goes hand in hand with the FFCRA, which is the Family First Coronavirus Act, which is handling the paid sick leave, the 6 qualifications, and or expanded FMLA leave. Now, the FMLA leave only pertains to reason number 5, which is the school closures and things like that. But to really back it up to whether or not somebody qualifies for FFCRA paid sick leave. The 2 things to keep in mind is when FFCRA applies is if there's a healthcare or medical provider direction to get tested or get quarantined. That's number 1. You, the dentist, as the employer, cannot be that medical provider. It has to be somebody else, whether it's the Minute Clinic, a health practitioner, or whatever it might be. They have to direct the person getting tested, and if quarantine and isolation comes into play. So that's really the qualifying factors to consider if FFCRA is going to apply. So when it happens that, let's say, a team member comes to you and said on Monday and says, guess what? I wasn't feeling well over the weekend. I went and got tested and I'm positive. What happens? Well, again, your state department a health department is going to give you guidance. Dr. Rosato did mention it a little bit on his video about what happens, what most states are telling practices, and that is, it really all depends on that definition of close contact. If you are being vigilant with your PPE and having those isolated, times where you might be with a patient, what the risk of exposure is, it's very, very low in the dental practice because you have all those layers. Again, having those barriers, seeing one patient at a time, that really goes to your benefit when a team member or other person tests positive. So the first and foremost thing is, show care and concern and compassion. Above all else, we're all humans, and this is going to happen. And then you also have to put your employer hat on and be respectful of the Americans with Disabilities Act, the other ADA that is in full effect when it considers a medical diagnosis that you cannot share that with anybody else. And what I mean by that is, again, your state health department or the medical provider who made the diagnosis can offer guidance on who needs to be notified. If it's a team member, of course, you want to let your other team members know, but you cannot divulge the person's name. Again, for HIPAA reasons, for confidentiality under the Americans with Disabilities Act, it's considered a medical condition. You are not at liberty to share that information. Now, if your team member chooses to post it somewhere, that's on them. However, from the employer standpoint and in the notification process, whether you have to notify other patients or not that team member came in contact with, you cannot disclose that person's name. So you have to be very generic that it's been brought to your attention or you've been notified that someone that they have been in contact with or who was present in the building at the same time as their appointment has tested positive. Reassure them, because of all the safety protocols you have in place, their chance of exposure extremely low. However, you feel it prudent and out of an abundance of caution to let them know to monitor themselves for symptoms. Again, your state health department, even the ADA, I believe, or the CDC does have some recommended verbiage for that. And that'll be helpful. So as far as notification, again, the answer is it all depends. It all depends on who it is. Now, I'll jump ahead to what if the doctor tests positive and the office has to close? What happens then? Well, it just so happens I have a client experiencing that. And that is he has to close the practice for 2 weeks. Now, he was hoping that he could pay his team FFCRA, paid sick leave, because it was, him who tested positive and he can't work, therefore they can't work. The Department of Labor is very, very clear about when FFCRA can be paid. If the office closes, FFCRA is off the table. You cannot continue to pay anybody under FFCRA. Therefore, your only other option for wages during an office closure, if the doctor tests positive, is unemployment. So again, the Department of Labor is very clear about that. Now, looking at the calendar, we are 6 weeks from today when FFCRA expires. So in the next 6 weeks, FFCRA will apply, but as of January 1, it goes away. The wages that an employer is going to pay for FFCRA is eligible to be reimbursed through payroll tax credits. Now, I've also heard, and there's been a myth circulating, that if you got the PPP, the PPP loan, you could not get the payroll tax credits. That is not true. And I got that from the IRS and some expertise from CPAs that said what happens is there's been some misinformation and misconception out there. If you did get the PPP loan, there are certain requirements for qualifying for forgiveness on that. And the FFCRA, you just can't double dip. You can keep both, but you can't expect to get payroll tax credits for FFCRA and include that under wages for the PPP forgiveness. I think that makes sense. You just can't double dip. But if you did get the PPP loan, you are still eligible for the FFCRA payroll tax credit reimbursement for those wages that you pay under FFCRA. So I'm hoping that clarifies some of it. I know there were some questions about that. I think, that kind of covers what FFCRA is about. Like I said, there is some flu season, stomach bugs. Let's say somebody says, I have symptoms that could be COVID. I'm going to go get tested. But then it turns out a couple of days later, oh, they just have the flu or they just have a stomach bug or whatever. They could qualify for FFCRA for those few days that they're getting a diagnosis. But once that diagnosis comes back negative, then FFCRA no longer applies. And again, the maximum someone can get paid leave under FFCRA is up to 80 hours or 2 weeks of a 40-hour work week. If you work 32 hours and you're out from a positive symptomatic COVID test, then you get 64 paid leave hours because that's your normal schedule. I know there was some confusion about that. Of course, if the doctor requires someone to go get tested, then the doctor is responsible for payment of the test, as well as the wages for the employee to go get the test and come back to the office or return to home, or however it might work out. So be mindful that doctors, if you do require someone to get tested, that you would be on the hook for either paying for the test up front or reimbursing the employee once they handed in, the receipt of getting tested. There's great guidance out there as far as, if you're asymptomatic and you test positive, if you're not symptomatic and you test negative, when can you come back? All of that good stuff. Again, I won't, go down that rabbit hole and go into the details for that. But I think before I move on, Ashton or Kirk, I think that addresses most of the FFCRA questions. Is that correct?
For the most part, yes.
Okay.
So
do you want me to pause and we'll just jump in and see if there's any others?
Oh, there's lists and lists worth of questions that are going on, not only here, but on that Facebook page as well.
Sure.
All of what you saw were just, what do we do if someone tests positive? My wife tests positive. Can I not go in? Am I supposed to quarantine myself? I mean, if I had one assistant that actually did test positive, does that mean that I'm now out for the next month or few weeks or whatever it be? There's just so much uncertainty. And like you said
Sure.
earlier, There's those that will require it and others that don't. There's just so much uncertainty with it. Whether it's just to you as well, Rob. I mean, we've got Kirk, we've got Bill, we've got Barrett, everybody else that's on here. What do we do?
And I think, again, it will be case by case specific. I don't think there's one global answer, because it is dependent on, the definition of close contact, longer than 15 minutes and closer than 6 feet for an extended period of time. So, depends on, is it, your brother, sister, cousin's neighbor? Where is that? Where do you draw that line? And again, the state health department is pretty much your first phone call to find out, here's my situation, because there's always going to be nuances and caveats. Some practices have said, well, we're just going to test everybody once a week, and we'll go from there. Well, that's okay in theory, but the reality is if you test me on Monday and I turn up negative on Wednesday, what if I got exposed on Tuesday and then I test positive on Friday, but I'm not going to be tested again until Monday, So in theory, it sounds like a great idea or proactive measure, but in reality, it really doesn't make any sense. The other idea about, everybody's going to test for COVID at the first sign of a cough or first sign of a fever. Again, going back to have a plan, decide as a team, what makes sense. What are the health guidelines? What can we do? What do we all feel comfortable to do? And, again, there's going to be some differing opinions about how some people are super paranoid about it. Other people are pretty lax about it. You have to come together as a team for the betterment of everybody to make sure that you keep each other safe.
Having everything with the State Department and accessing them first seems to be the first answer anyway. But
Absolutely.
Even back when we were dealing with this back during the COVID conferences and talking about it, we kept going over and over again how important it was that you had conversations with your team members.
Right.
That it made sense to you, that everybody was on the same page. Because if you weren't, then that was just starting, like you said, down a rabbit hole of terrible situations. So am I going out on a limb too far by saying it has to just make sense with the way that you're approaching this?
Well, it has to make sense, and you have to make sure you're following any employment laws like the confidentiality, the flow chart or the next steps as to who does need to be notified and who doesn't need to be notified. If it's a hygienist, maybe it's just the patients that she had that day. Depends on when they determined when was their first symptom and when did they test positive. What if they didn't have any symptoms and they just went because, they found out that a gathering that they were at on the weekend, somebody tested positive. So just out of precaution, they went, turns out they're positive, but they didn't have any symptoms. Then, what is the notification tree from that situation? So, going back to the idea that there's just no one global answer for every situation. You have to consult with the state health department, even your dental society. They might have some great resources too.
Robyn, listening to you and listening to Rich, it was kind of an aha moment. I think back in the COVID conference, our mindset, at least mine, was all on PPP and how do I not infect my patients or become infected from my patients. And I think we can all say that PPE works, masks work, face
Absolutely.
Like the infection rate from patient to dental team member is remarkably low and quite amazing. And listening to Rich, now that mindset is no longer am I as concerned with that, but it's when my hygienist tests positive. Because if I think to the workflow in my office, we're not socially distanced in the lunchroom. We're not socially distanced perfectly for team meetings. And it'd be hard to do that. And so, if I'm just being humble and vulnerable, and I'll bet a lot of people are in my scenario, there's a difference between what's going to shut me down is not going to be a patient. It's going to be me or one of my team members. And so as a team, I think we have to make a decision. Okay, this is going to happen when, not if, when one of us gets it. So we can either accept that risk and say, we're going to have to shut down, and that's potentially going to have financial ramifications on me and all of us, or we can change our workflow. We can wear PPE without doubt. When PPP is off, we cannot be within 6 feet of someone for more than 15 minutes for a 24-hour thing. And that's going to change the enjoyment of work, in my opinion, in a negative fashion. Okay, but maybe that's worth it. There's lots of questions about what happens when this, and what happens with someone that's outside a dental office and exposed. And I think it's fair to say, let's all commit to the idea that an exposure to an exposure, there's no mandate. So if a team member is exposed, that doesn't mean you have to shut down. That doesn't mean
Correct.
you have to notify anyone. I'm sorry, an exposure to an exposure. So the team member that goes to a party and there's someone that's exposed there, that person just has to follow the CDC guidelines on quarantine. That has no effect on the team. So the hard part is when someone within the team or a patient is positive. So would you agree, Robyn, that that's an accurate statement?
Yes, that's an accurate statement.
Okay, so comment on that, Robyn, just what I said, what I have to think about in my practice. I have to go to my team and like, I've been missing the magic question team. It's not about our patients, it's about us. So how do we eat lunch? How do we want to meet? How do we want to walk through the door? Can you give us any insights on what practices you're consulting with are doing regarding?
Sure. Well, I can tell you right off the bat, one of the 4 offices that spoke to me last week, so they had an assistant who ended up testing positive, and she had been to work Monday and Tuesday, found out she was positive on Wednesday. And I will tell you, in this particular case, she was very resistant about going to get tested. But she started exhibiting symptoms, and the doctor says, you need to go get tested. And sure enough, she was positive. So the hospital where she went to get tested had to then alert the health department. And of course, the dental practice took the initiative to contact the health department to say, hey, this is our situation. And they were advised to look at Monday and Tuesday schedule. How close were they? As Dr. Rosato was saying, what is your lunchroom labeled? Are you seeing one patient at a time? Is there a barrier at the front desk? Are you always wearing your PPE? They are getting very, very, very specific with their questions to help with the contact tracing, and then to advise who do you need to notify and who don't you need to notify. Well, the other assistant and the doctor that this assistant worked with had to go get tested. Out of an abundance of caution, the dentist also recommended that everybody else in the practice, again, because they didn't have they had shared lunch, where they took off their PPE, and while there wasn't a whole lot of congregating, it was a relatively small lunchroom. And there were times when this positive team member didn't have the mask on. So, again, everybody was a little nervous, so they went and got tested. Everybody else, the doctor, the other assistant, all the other team members tested negative. So that's the good news. And it made it very, very clear to them where they were vulnerable in combating the next possible scenario if somebody else on the team tested positive, where they could potentially have exposure. And so, yes, the exposure was real. Luckily, they all got tested negative. I believe they're testing again this week to make sure. Because we know, again, false positives, false negatives, all that, but again, monitoring for symptoms. So in situations where team members have come to the office and then discovered they're positive, and then there's situations where maybe over the weekend they tested positive and then alerted you on a Monday, also goes to the deep cleaning of the office. So that particular practice, again, using them as an example, they canceled the next morning's patients and just deep cleaned every possible area that this assistant could have come in contact with, again, out of an abundance of caution. They were not advised to do that. They took it upon themselves. And I think, again, it was a great thing that they came together as a team and said, this is what we feel comfortable doing. So it does go back to coming together as a team and saying, when this happens in this scenario, this is what we're going to do. Of course, our first phone call is the State Department of Health. Now, you can do that right now. when you don't even have that emotional piece to it, you can just go ahead and be proactive and call them, say, okay, here's my, I'm a dental practitioner. We want to be prepared. What is your advice for somebody when a patient tests positive and when a team member tests positive, et cetera? So that way you have that in place already. And the anxiety level can certainly come down knowing that you're prepared. Does that answer your question, Barrett?
It's beautifully done, Robyn. Are you kidding? So there was a question that popped up. Per Barrett's statement, what are our choices regarding an employee's exposure to an exposure? Is the only choice a 14-day quarantine, or can negative tests over a period of time allow an employee who is in direct patient care to return to work?
Great question. And so again, I will defer to my medical colleagues for that, but I will share with you what my experience I've been told has happened. For example, a team member's spouse got exposed at work and tested positive. She's, again, not showing any symptoms. Out of precaution, she'll get tested. Typically, you can anticipate that person out for 3 days. And yes, FFCRA would apply. When she gets that negative test, she can return to work. But again, it will go back to what are the nuances of when did the husband get exposed, when was he tested, and when was this team member in the practice. So you might want to, again, get advice from your state health department about that secondary exposure. But sometimes if this person does start showing symptoms, then I believe it's the 10 days or resolution of symptoms within 24 hours. It's 10 days from the onset of symptoms. So again, when is the clock start ticking? That'll be up to the medical practitioner and the state health department to tell you when do you start clocking that 10 days or that 14 days.
It's funny how as dentists, we try and be our own doctors in all of this. Yeah, we like to think we know exactly when it happened, how it happened, what to do with it. But like you said earlier, every situation is going to be very different in how to respond with it.
It is.
I'm going to go back to the Facebook page and see if there's any questions there.
And just to clarify, the choices regarding an employee's exposure to an exposure. So an exposure to an exposure is nothing, according to the CDC. So if my wife has coffee with her friend Sally, and Sally says, hey, I just found out I was exposed, meaning I went to coffee with Susie. Sally's been exposed, but she's not positive. My wife wasn't exposed to an exposure. So there's zero, to answer that Dentex question, there's zero rules. You'd have to do nothing. The only time anyone, under my understanding, the only time anyone has to do anything is when you're exposed to a known positive or someone that has very symptomatic that has not been tested. Then you have
a probable
case. Then you have to go to the CDC guidelines and the State Department of Health and follow. But just to clarify, because this exposure to exposure is everywhere. It's in our communities. It's at
the grocery store.
Rotary clubs. Everyone is talking about exposure to exposure. And we can solve a lot of these questions. If we do exposure to exposure, you have to do nothing. An exposure to a symptomatic patient, a probable patient, or a known positive, now we got to dig in and figure it out.
Yeah, now you start going through the steps.
Yeah.
Right.
I've got a question about, again, the dentist being required to pay for it. That's a gray area, it seems to me, because if the dentist says you must go get tested, then clearly the dentist has to pay. But if it's sort of the team's decision that, maybe we're going to go get tested, how does that fall out?
That's a great question. If it's, again, part of the employment process, the employer is going to be responsible. So it could be mandated, it could be required, but it also could be out of safety, the employer's obligation to keep a safe work environment, to have people go get tested. Now, if it's a voluntary thing and I refuse to go get tested, then that goes into a different realm of could potentially be disciplinary. However, again, it depends on the situation. And is this person symptomatic? What was the exposure? It's just not a, hey, let's all just go get tested for the fun of it. So I think there are guidelines as to who's requiring it or who's recommending it and the reason behind that. Does that answer your question?
Sort of.
And unfortunately, there's no black or white answer.
Right. Yep, I get it. Thank you.
Sure.
Any other questions, Ashton, you can see from the feed, or Barrett, or Bill,
Just
or Ange?
now. The vast majority of them, it's still so much of, what about this situation? What about this situation? There were probably 14 questions that came up very quickly, one right after the other, that were all basically the exact same question, just with a small little difference in the situation. And like Barrett said, like Robyn's been saying, like Rich said earlier, be cognizant as to what's actually going on. See what the actual true exposure really was. And like Barrett said earlier as well, the PPE, we know it works. And if you were in a situation where you were staying protected, you were staying distance, you were going through the steps, and not to be condescending, but calm down. You know, you're doing what you're supposed to be doing, and you're following what the CDC is asking for, what you know, all of the state health departments have been asking for as well, and what the ADA has been strongly suggesting since back in March.
Right. In the CDC, I mean, the CDC pretty clearly, in my opinion, lays out the basic examples and scenarios, especially if we're trying to answer questions for patients. I was exposed or I have a positive. It's very simple. Go to the CDC, make them wait the 14 to 21, 24 days, depending on their scenario. That's easy. You know, if we're a dentist trying to think how to best run our business, my advice to everyone is going to be, like I said before, backtrack to the scenario of how you or a team member is going to get it, and then what happens. And I've just realized today that I'm shutting down unless I make some changes. And I'll bet a lot of us are in that same boat. And so if, you know, my perspective is, if when someone on my team gets it, whether I pay for the test or not, great. Doesn't matter. Whether FFCR is going to pay or whether unemployment, that's all going to happen. And it's important to know those details. And it's important to do things in a legal way. But that's all the details after the most important thing. And that's someone getting it and having to potentially shut down. And when can we safely and legally come back? So if you're where I'm at, it's okay. Let's figure out what's going to happen when someone gets positive. And then we're going to figure out, when that happens, how do I mitigate my financial and legal risks going forward? But that's the big question, I think, above everyone's head right now, is this is going to happen.
Well,
Right.
to have something, go ahead, Robyn.
No, go ahead.
To have something like this video that's been suggested from the ADA and from HR and from different situations to have, as we've been saying a few times now, you have to talk to your teams. You have to have a battle plan as to what you're going to do if these situations do arise. So to have this video as a training course, at least a little bit to start a conversation, is a great way to begin. But if you don't have the conversation, then you are going to have that moment of, oh, crap, now what do we do? And that's not a good situation to be in when it actually comes to full reality. It's just not a good way to go.
Absolutely. And to answer your question, Barrett, as far as shutdown is concerned, in my experience, the only time a practice really has been kind of forced to shut down from COVID is when the dentist, the provider, has tested positive. So, you know, if a hygienist or another, you know, assistant or front office person has tested positive, that does not automatically warrant closing down. Now, if it internally,
this is super important. So I'm going to stop because, okay, so let's use my practice, and I'm totally humble and vulnerable. So in the lunchroom, we do not meet social distancing requirements. So they're within 6 feet, some of them. We're not wearing masks. They're eating and talking. We have a small office. During team meetings, we're closer, but probably not. So if tomorrow a hygienist gets it, I will have to answer to the health department like, no, we've all reached that threshold of being exposed. So in that case, since as an essential healthcare worker, oh, my dog is squeaky toy. Oh, come here.
I love it,
I am so sorry. I bought these toys and they're squeaky toys. Oh gosh. So, where was I? That just threw me off. So when my hygienist gets it, we're not going to meet that threshold, Robyn. So are the rules of quarantine different for essential healthcare workers based on a negative test? So my understanding is if someone is exposed, a regular person that works wherever, a negative test does not get them off a 14-day quarantine according to the CDC. Is that different for healthcare workers?
Great question, and I don't have the answer to that. And I would, again, defer to the CDC and the public health departments, because I know there are different rules for different states and how they view that. So it's a great question. I wish I could give you an answer, but I can't.
One of the questions that popped up, my hygienist doesn't want to see nurses who work with COVID positive patients. Any thoughts?
Well, now, that becomes, an employer-employee relationship issue. And it depends on what the understanding of the job description is and your employee manual and the expectations of behavior in the practice. I can tell you back in the 80s with, HIV and things like that, that did, people who refused were then asked to choose another profession because it was going to be part of the profession. And so I would first and foremost sit down and have a conversation with that hygienist and understand the concern about the refusal. Could be that, they have young children at home or immunocompromised spouse or other family members that they're around, and it increases their risk of transmission. Whatever it would be, I would say have that human conversation first. And then ultimately, if it's a requirement that a hygienist who has all the appropriate PPE, even before COVID, the decision then determines, can you still be a part of our team?
It's a tough situation to be in, but reality
Extraordinarily tough.
I had one hygienist actually that she was terrified when this all started to come back to the office. And so she was gone for a few weeks. And the question came up back during even the conferences, we talked about this kind of thing of, is she allowed back? Should she be there in the first place? Again, it goes back to office by office and team mentality.
Expectations and what is the requirement of the position?
Right. Absolutely. Well, we're at the top of the hour, Kirk. What do you think? Should we keep going?
Awesome. Unless there's other questions, I think we can wrap it up for the day, and just want to give a huge shout out, thanks to not only my team, but the team at the ADA and Bent Erickson for lending your expertise and guidance and leadership throughout this whole thing. We're going to continue to lean on you guys, and told you for future projects as they come about. Next week will be Thanksgiving, so it'll be hard to get an update there. Maybe the following week, if we can. You guys just keep sending us questions, things that you guys want to see. We'll monitor the Facebook group pretty well, and just do our best to be here to support you guys through beyond this whole crazy thing. And I guess I'll just leave with saying this: a great time to be thankful, even in a crazy year. So hope you guys all stay safe. Have a great Thanksgiving, and we are grateful for you. I'll say that.
Hey, Kirk, what do we got coming up in 2 weeks on ACU?
Hey man, I'm so glad you asked, because I've been working on this. So on December 4th, thought you never asked. We at Act Dental U, it's been really, really fun as we've grown, and today's Dr. Stephen Chu was amazing. So on December 4th, which is Friday, we're actually gonna be doing a team program. One of the requests that we've been getting a lot is, hey, look, can you help us with verbal skills? not only in verbal skills and scheduling, but these tough questions that keep coming in. How can you guys help us with verbal skills? So Angela was kind enough to help me pilot this, where we're organizing the toughest questions. So we're going to bring you answers to the toughest questions you guys get all day long as an office on ACT Dental U. It's a team program. It'll run from 11 o'clock Eastern time until 1 o'clock Eastern time, Friday, December 4th. So rally the troops, tell your friends, bring your team, get ready to take notes, send us the questions, and we'll dish it back to you and give you some good tools to deal with the toughest stuff you guys deal with. What do you think?
Everyone that's currently a member of ACT, you go in your library, go to the community and post your questions. So Kirk,
yes,
with a great answer, and you can literally have the ammunition for all your toughest questions when you go back. But enter those in the community. If you're not an ACT member yet, get on in there. We'd love to have you. It's awesome.
Yeah.
If you didn't hear Stephen Chu speak today, you missed an amazing lecture. He went solid for 2 hours, and it was not only new and innovative information, but his clinical honesty is really refreshing. So
he was brilliant.
If you didn't hear it, it's in our library now, and
Yeah.
you know, the access to the library is by joining. So it was a wonderful lecture.
I like what he said. Can I share one more case? And it was the ultimate failure.
Yeah, exactly. He ended with one of his failures. It's exactly right.
Awesome. Well, gosh, I just appreciate this so much. And we're here for you guys. If you have questions, reach out to us. But we'll be back again next week with some good stuff, and actually the week after that. So again, take care of yourselves. We're grateful for you guys, and happy Thanksgiving, everybody.
Happy Thanksgiving.
Hey, if you enjoyed this week's episode of the Best Practice Show podcast, we invite you to check out actdentalu.com. ACT Dental U is the essential resource for anyone at any stage of starting, growing, or running a great dental practice. Whether you're just getting started or whether you're a well-established dental practice, ACT Dental U can help you and your team get to the next level with our extensive course library and all the current best practices in dentistry, and our Friday master classes and workshops for you and your team, and a supportive, active community to help you along the way with encouragement and feedback. ACT Dental U is the perfect place for any dentist to create a better dental practice so that you can have the freedom to enjoy a better life. So check it out at actdentalu.com.